Hello, I'm Margaret Moore. I'm the founder and CEO of Well Coaches Corporation, which I started 8 years ago to really develop the professions of health and wellness coach in healthcare. And I am determined to help build a scientific, intellectual, and academic foundation for coaching. And I am absolutely thrilled to have begun to collaborate with Carol 4 years ago that led us to our Harvard Coaching Conference yesterday and co-founding the Coaching and Positive Psychology Initiative. Now, I came from 17 years in the biotechnology industry, and so part of that I spent 5 years as the COO or CEO of biotech companies. Those are research and development companies. So that's raising venture capital, hiring scientists, collaborating with physicians, building research, building clinical development. One project was managing 20 scientists and physicians in 4 countries to build research and development. And so my particular lens is, does coaching work? Is it safe? We talked about the issues around therapy and coaching. Does it work? Is it effective? And do the returns justify the investment? And so I'm interested in the common denominator across all coaching, which is why I presented at the conference a new meta-frame for coaching psychology, which I think can be a highest common denominator. But then I think we have to break it down into our various market segments. So the metrics for which we measure coaching in executive world is different from life coaching and is different from healthcare. And so I think the 2 big questions, does it work and are there returns, will be answered very differently in those areas. Because I've built a community of 3,000 coaches, we've got access to a lot of research settings. So we now have 5 research studies going on, a randomized study of 200 hospital employees who have metabolic syndrome, which is basically 100 pounds overweight and everything that could go wrong has gone wrong. We have a study with women with cardiovascular disease. We have a study with phase 1, I would call it, with wellness coaching with cancer survivors. We have a study with a weight loss at a hospital in Texas. And last, post-bariatric surgery at Emory University. So my mission is really to find the way to raise a lot of money, to build outcomes, randomized control studies, to take all of these particular research agendas forward in the healthcare space. And because I have 25 seconds more, let me just honor my colleague Gabe Heistein here, who is our behavioral psychologist. Gabe and I are working really closely. She has been in NIH-funded research labs for much of her career. She did her PhD under Jim Prochaska, who developed the trans-theoretical model. And we're here today to collaborate to really take this forward. Thank you.